There you go. He loves doing that.
A roommate and I got Slater sophomore year of college. Slater was with us every day. I mean, he was at every party in college. We took him everywhere with us. We always took him on campus. He loved people. Slater had a slight limp, and we kind of assumed that it was from when he just kind of jumped off the bed too many times that day, or just kind of sprained something. So, we took him to the vet, and she was pretty sure that it was like early, signs of having the osteosarcoma cancer in his shoulder. It makes you start to think about having to say like goodbye to your dog, which is obviously never a great thing to think about. So it was kind of heavy, So yeah, we found out and she passed us along to the specialists at PVSEC.
My name is Pedro Rivera. I'm a second-year surgery resident at Pittsburgh Veterinary Specialty and Emergency Center. I currently treat both canine and feline patients, anything for soft tissue and orthopedic conditions, both elective and emergent. Sarcoma is the most common primary bone tumor that we see in dogs. What we do for diagnosis is essentially obtaining radiographs. Radiographs gives us actually a presumptive diagnosis because 85% or more of these aggressive bone lesions that we see are going to be, unfortunately, osteosarcoma. When it comes to treatment for these animals, we have anything from base pain management. We can escalate to local treatments like radiation therapy, where we focus the beam at the area where the bone is affected, or we can consider doing surgery. Surgery has two tiers. We can consider amputation, where we are actually removing the entire limb. The other would be limb-sparing surgery, where we're actually removing the piece of bone.
So it seemed like the main treatment for it was amputation. The vet assured us that it was going to be harder for us than it was for him, that he would adapt. We decided to go for it and we got the amputation. It was hard to see him at first, but I mean, he walked out of there the next day by himself, and he's 100 and some pounds, so I wasn't carrying him. And that kind of gave me hope, because he walked into the house, he walked outside to go to the bathroom. In a couple weeks he was walking up the stairs.
Most of these animals will cope very well after surgery on being on three legs. They can run, they can play, they can snuggle, they can be the good old dog they used to be before. It's been an honor to be part of this great study. Essentially, it's a partnership between Pittsburgh Veterinary Specialty Hospital and also Dr. Wise Osteosarcoma Research Group. Our partnership is based on we obtain the samples, normal bone, cancer bone, and also blood. If we can learn more about this cancer based on what we learn on dogs, and if we can actually try the different treatments and see how patients respond, and we can hopefully translate that to the humans and the kids down the road.
The dog model of osteosarcoma is the best model of osteosarcoma that exists on planet Earth. It is far superior in every way imaginable to the mouse models that we use and to the cell cultures we use. I was able to find some veterinary oncologists at the Pittsburgh Veterinary Specialty and Emergency Center in the North Hills who treat canine osteosarcoma. And we reached out to them, and to find that they were really excited about collaborating with us in research was just fantastic. And it's been a wonderful partnership that we certainly hope to develop over the years.
So why are dogs a great model to study osteosarcoma? First of all, the incidence. Dogs are 27 times higher the frequency of having osteosarcoma as compared to humans. That means that we can gather more samples in a reasonable time, and also the longevity of the dog as compared to humans. We can actually do treatment trials and see how the disease will behave throughout the life of the dog as compared to a human. The progression of the disease is very similar. It starts in the bone and it spreads in the lungs. The cost is typically a little bit cheaper to do studies in canines rather than in humans. The environment, these animals, they share the same environment as us, so we can hopefully eliminate certain environmental factors. So it's a win-win situation. We are actually helping them, and also they're helping us by obtaining these samples and helping us learn more about this disease.
When Slayter and I were at the vet for the appointment to schedule the surgery, and I was signing all the paperwork, they asked me if they could donate his leg, and I just asked them why, and they told me it's because they send it down for research, and they actually use it to try to research off of for children and for adults that have osteosarcoma. So, of course I said yes. To think that that could go to the research to help human beings too was awesome. I didn't see why anybody would say no to that question.
So people should care about the Pittsburgh Cure Sarcoma because we are gathering funds to essentially promote further research so we can actually understand how this cancer behaves, so we can actually find a cure one day and improve the quality of life of not only your kids, but also dogs. I'm also in line for a grant. So your contribution to Pittsburgh Cure Sarcoma, it's going to elevate science and hopefully find us some answers. For centuries, dogs have joined us humans in our travels as man's best friend. So it's only fitting that we value dogs as our companions in our journey for scientific discovery.
Yeah, so he's the same Slayter, 3 legs. We just weren't ready to say goodbye to him yet. And this gave us, he's been the same dog just a couple months after, losing a leg, and that was awesome for us. It was worth every penny for us then.